Well, if we could bottle the secret to looking young, we'd make millions, billions.
You actually would. Americans are expected to spend more than $100 billion on anti-aging products just this year.
Makes sense, but Jason, when our medical expert asked you what you do with your skin, you said...
Soap and water. When I'm being fancy, I use the soap. Yeah, I kind of would laugh at all the products my wife would use on her face, her whole routine. At least I used to laugh. Now I'm on a 4-step program in the morning and at night. I even let a doctor use a laser on my face just Friday. You don't have to go that far. New this morning, how men can help keep their skin looking young. I do the obvious stuff. I stay out of the sun. I've never used a tanning bed. I've never smoked. But when it comes to taking care of my skin, it's Irish Spring. I'm a typical guy.
I think that because men are lucky, they have thicker skin.
Dr. Jess Prischmann runs her own Twin Cities facial plastic surgery practice.
But I think once you begin a discussion, I really think that men are interested in knowing what they can do.
Dr. Prischmann started by putting me on an anti-aging skincare routine, a cleanser, 2 different serums, a toner, and moisturizer.
Usually men will come when there's a problem. So men are really problem focused. Women are more focused on the preventative side of things.
I thought using all this stuff would take forever, but it really was just about 5 extra minutes. Vitamin A and vitamin C in my morning serum, powerful antioxidants, make the skin behave younger and fight sun damage. Alpha hydroxy acids in the active night serum, glycolic acid, encourages cell turnover and improves texture. I'll try to be a good patient here. All right.
No, you're a superstar.
Then we get a little more aggressive.
There's varying depths of a laser peel, and we're going to do the lightest level on you.
This is called a micro laser peel. 4 microns for me. Some people do 80. People will really do that?
Yes.
Wow.
Yes, they will.
On go the goggles, and the doctor fires up the laser.
We're resurfacing your skin in an attempt to stimulate good, healthy cell turnover. Because as you get older, your turnover slows down.
Basically, the heat of the laser is zapping the top layer of my skin. It does burn a little bit.
Yeah, I'm all right. I definitely feel it.
It's not that everybody should run out and get laser peels. And it's not that everybody should run out and get chemical peels. It's that we have these things that work out there.
New fad treatments come and go, but Dr. Prischmann says the things that work have been around for a while.
Lasers have come a long way, but you're right, this resurfacing is nothing new.
Now, when you kind of started out this process, you were a little skeptical, like...
Sure, right. I'm like, am I going to have time for all this? Is it really going to make a difference?
Yeah, you thought it was going to add all this time onto your daily
And that's what
routine.
I was thinking, too. It seems like a big time suck, but you're saying a few minutes,
I mean,
right?
I don't wake up any earlier, and I still am here at the same time, so it takes about 5 minutes to do the extra stuff. Huh. And you can use the cleanser in the shower, and then, you know, these are the products here. I put links to all these products at WCCO.com if you want to take a look at it, if you're a guy and you're curious about this stuff. But the whole battery things, you know, the upfront cost,
yeah, it's a little investment.
It's about $200 for this stuff, but then it lasted me 3 months. So you think like, well, you know, I mean, honestly, for the payoff, the biggest thing that I think was eye-opening for me is the fact that just by using a cleanser and a moisturizer, if you don't even want to go as far to use the toner or the serums or whatever, but by moisturizing every day, I had no idea how bad my skin was. I thought it was fine. And now that I know what it can feel like, it's like, oh my gosh, it's a total change.
What happened after the laser?
It was red on Saturday. It looked like a sunburn, and I had to have kind of an Aquaphor, which is like a Vaseline type thing on my face, all Friday and Saturday morning. But I went out Saturday afternoon. Sunday,
Nobody was like,
you didn't scare anyone?
I looked like people thought I had a sunburn.
Okay.
And then Sunday I was fine, and Monday I was on TV. So that's really
Not a lot of downtime.
Yeah, virtually no downtime.
Is it super expensive?
It's about $300 for the laser thing.
Okay.
And then
Starts
how
at
often,
that, depends
how
on
often would you do that?
Maybe once or twice a year, depending on what you want.
All right. Well, all right.
So it's all depending on what your priorities are and what's in your threshold.
Jason, taking one for the team.
I know, really.
Jason.
It was fun. I will say the whole thing was fun.
I feel like I'm going to need the 40 or the 80.
The 80. The 80-year downtime is a long time.
Can you
for that.
imagine?
I just might need it because I've been enjoying the weather a little bit too much. I've been wearing sunscreen, but you know, you just stay out so long.